get. Hi, this is Sally Morgan, physical therapist, craniosacral therapist, and Tellington T-Touch practitioner for animals and people. This is Tristan. He's a Corgi. And this is an episode of Conversations with a Corgi. It might even be number 150. Woohoo! It seems like just yesterday we celebrated the 100th anniversary of Conversations with a Corgi. And 150. I just can't believe it. I'm sure my sister is over 250 at this point. And as she has pointed out, some of hers are pure entertainment value, no information value. And we may be getting to some of that as we proceed along, because I just have so much going on right now. But anyway, I wanted to talk today about alternative medicine, because a lot of people don't understand what that is. They don't know when you should bring your pet for alternative medicine treatments. And interestingly, that led me on a journey very similar to what happened when I was talking about Reiki and doing some research for those shows. Alternative medicine includes the terms integrative, complementary, even holistic therapy. They're all used interchangeably by people, but in fact, each one of those words means something different. And alternative medicine is used to describe anything outside of the traditional or mainstream treatments. However, the National Center for Complementary and Integrative Health defines alternative medicine as that which is used absolutely instead of conventional medicine. Now, for us with our pets and most people, we tend to use a combination, because my feeling usually is if this thing doesn't work, I have a backup in place. And, sometimes the combination can work better than either alone. So Wikipedia, however, as it did with Reiki, has about 6 pages about alternative medicine being unproven, impossible to prove, lightly researched, and not many tests have been done to prove it or not prove it, and that it hasn't been shown to be any better than the placebo effect. Now, as you recall from one of my prior talks, we looked at this book, You Are the Placebo, by Joe Dispenza, and he is one of the chiropractors in that movie, The Secret. So the placebo effect is not to be disregarded. It has cured and helped many, many people to believe that something they are using is working. And it's happened so often that it's impossible to rule it out as just like, a fluke with that one person. And even high-level people in medicine who have practiced for years. I'm losing my Corgi, sliding down my leg. He's trying to go over to the table. I got to take George off the table. He wants George. Who's a stuffed Corgi. So even high-level medical doctors who've been working in traditional medicine for years ascribe to some of the components and aspects of alternative medicine. So as much as Wikipedia tends to, and probably to cover themselves in terms of suing, they have said so many things about it being disproven and unproven and invalid. But the placebo effect cannot be discounted. As I was saying, many medical doctors, even after years of practice, can say, you know what, the placebo effect works sometimes, and so I am not going to rule that out as a possibility. And many doctors have gone so far with certain patients to even use the placebo effect as a way to improve that person's healing. And as I mentioned in a prior episode at some point, and I probably will mention it several more times, in our PT journal many years ago, there was an article about the efficacy of various treatments. And one of the things they found is that the therapist performing the therapy, their belief in what they're doing matters more than the therapy that you're using. So if I believe ultrasound's going to help your tendinitis, it's going to help your tendinitis. If I believe e-stim is going to change that tendinitis, then that's what's going to happen. If I believe myofascial release and manual therapy is going to fix that tendinitis, then that's what's going to happen. So it doesn't depend so much on what the patient's perception is of the efficacy, because most people are pretty unaware, and they're coming to you for help. And so if you are quite convinced that what you're doing works, no matter it has been highly researched or lightly researched, then the person that's experiencing that modality will tend to get better from it. So let's look at some of the things that are included under the title of alternative medicine, or, in some places, integrative and complementary medicine and holistic medicine include different modalities. But as a group, there's quite a few things that fall into these categories, including acupuncture and traditional Chinese medicine. This has been, we've known about this for centuries. It's an ancient way of thinking, and traditional Chinese medicine, also called TCM, includes herbal remedies, and it's a whole system of looking at the body using 5-element theory, and then of course acupuncture, from which we get acupressure. And many insurance companies now cover acupuncture for people, and so that's one way we see in the United States that it's gaining acceptance. Another ancient healing tradition that we know about is Ayurveda. That is a treatment form from India, where your body is seen to fit into one of 3 doshas, and those include body types of Vata, Pitta, and Kapha. And then you have overlaps of those, and they do kind of a close analysis of you, like they do in Chinese medicine, looking at your pulses and your tongue. In Ayurveda, they look at your tongue and your skin and dryness, all the same kinds of things they look at in Chinese medicine, to determine which one of those types you are, and then to prescribe treatments, using oil on your body if it's dry, certain foods that you should eat or not eat depending on your body type, and tendencies of your mental states depending on which type of body type you have. So they prescribe different treatments to address balancing those doshas in you. And so then we have many treatments that were developed in Europe or the United States over the 18th and 19th centuries. That was the 1700s and 1800s. And even some into the 20th century. And that includes homeopathy, chiropractic, osteopathic, which is in fact different from chiropractic. Chiropractic manipulates bones with the idea that if these nerves are unimpinged, then you'll have greater health in your body. Osteopathic is a little bit more intense than that. They look at the movement and the bones in the head. And in our country, when I was going to PT school, I certainly applied to and thought about going to osteopathy school. But in our country, osteopaths are now seen quite similarly to MDs. Instead, they're DOs. And there is much more overlap between a DO and a MD than there is between a DO and a chiropractor in most cases. And osteopathy has now been pretty much accepted in the United States. It's no longer seen as an alternative medicine. And of course, this makes me happy because craniosacral therapy is derived from osteopathic medicine. And our beloved and famous alternative medicine practitioner, Dr. Andrew Weil, who is a traditionally trained doctor, he got his inspiration for medicine from an osteopath, a DO, who, Fulford, who was a doctor that he knew in his childhood, who still made house calls and did gentle work on the body to bring about health throughout the body. And then we have mind-body medicine, such as meditation and prayer. And then there's biofield therapies like magnetic therapy, light therapy, color puncture therapy, which is similar to acupuncture with color, any kind of bioelectromagnetic therapy, and just any kind of other body work. We have naturopathy, which is using herbs and supplements. We have also homeopathy, which is different than naturopathy. A lot of people don't realize that. Naturopaths in some states like Vermont are licensed to work kind of as a doctor in an independent setting, and they prescribe supplements as opposed to medications. And then they also can prescribe alternative treatments. I know that when I had cancer, one of the things I explored was IV vitamin C, and this is something a naturopath would do for you. Ultimately, I didn't think it would be that useful, so I didn't do it. And then we also have homeopathy, which is using tiny bits of something. For instance, if you have an issue with a bee sting, you'll use a tiny bit of bee venom and dilute it and dilute it and dilute it and dilute it, and use that to engage your body's immune system to combat whatever the issue is that you have going on. And of course, the idea of flower essences is similar to homeopathy. Bisky, what are you doing? He's like alternating his feet here. So homeopathy is not the same as naturopathy, and they're quite different. And I'm lucky to live in an area where there's tons of alternative medicine practitioners, and so I know somebody who does every single one of these things. And then we also have, related to the meditation and the prayer, people who do angel therapy and psychics that talk to your lost loved ones and things like that. We also have Reiki, which is another system of body work, which we've had several conversations with a Corgi about, where you're channeling universal life energy. So holistic therapy, strictly speaking, includes the idea that your mind can affect healing throughout the body and address the symptoms in your body, and that your mind, body, and spirit are connected. And holistic therapy is where I got the inspiration to call what I do holistic physical therapy. And certainly my sister and many other vets call what they do holistic therapy, because you're looking at the body as a whole. And this is a very different view than traditional Western medicine. And certainly in our country, it's different than it even is in Europe. And when I was in craniosacral training, one of the things we looked at was the different ideas about the bones in the skull. Do they fuse? How do they move? And we found out that Gray's Anatomy, which is the anatomy book we learned from the United States, shows that the bones are just labeled and there's no discussion about movement or the sutures between them. When you look at Spinoza's anatomy, which is used in Europe, it's an Italian book, it does talk about the sutures and movement in the bones. And Dr. Upledger once gave a talk in Israel early on and was talking about this amazing movement in the spinal cord and the bones of the head and face that he had observed during surgery, and no one applauded at the end of his talk because it was something they already knew, because they had learned from a different anatomy text. So look at the difference. Just that one change in a book can make into a whole school of thought around a type of medicine or a type of care. And then of course we have herbal therapy, which includes a bunch of herbal remedies. And we haven't even talked about essential oils, which some people would consider energy medicine. Other people would consider that a type of natural medicine. But certainly a lot of essential oils are pharmaceutical grade and must be treated with care. And then we have shamanism, which is for some people really out there, but it is sort of like prayer. A shaman will do an inward journey and go into an altered state of consciousness. Some of you may be of the age when the Carlos Castaneda books came out and he was working with a shaman. Shamans that I have been to do not use mushrooms. They just sing and drum and do a journey while they are working with you. And they get information from the universe that comes to them during that journey, which is helpful for you to bring about healing. They interact with the spirit world in their journey, and sometimes they'll interact with departed loved ones. They'll interact with your spirit animals, your spirit guides, your inner guides, and then they come back and give you some direction. And there are people such as my friend Wendy Weatherwax and my friend Tracy Broom who do shamanic work for animals, which is really a great way to work with them because we don't have words with them. And so we need to know if there's a deeper issue going on. Right, Tris? And with so many of us having rescued pets with sketchy first 3 years of their lives, it's important to address some of these underlying issues that could result in behavior that we just can't address with traditional training. And of course, the traditional training, so much of it is dominance-based. Even if it's positive, it's still based on that idea of stimulus response. You know, I give you a treat, you do this behavior, back to Pavlov. And we don't look at the animal as a whole, which is one of the most appealing things about holistic medicine for our pets. And certainly I want to do another discussion about this and maybe some more detailed about some of these modalities. But I want to talk about in another episode how to choose which one of these to do for your pets, or how to decide when indeed you need alternative medicine for your pets. And today I will talk to you about my journey with alternative medicine for my own personal situation. Who's saying hi? I can't read with my new glasses. Diane. Hi, Diane. So when I had cancer, I, of course, had already become a physical therapist. I was already doing cranial work. I had been doing T-Touch for 25 years. So this was a journey for me that was going to be different than for somebody else who was only looking at conventional medicine. And I went to see Bernie Siegel at one of his support group meetings. And one of the things he said has stayed with me. He said, no matter what happens, when you look back at yourself 2, 3, 5 years from now, are you going to regret the choices you made? Which is a good way to make any kind of a choice. Should I move to this house? Will I regret this in 5 years? I had a sense of that when I moved to my old house, but it did in fact work out for me in the long run. But anyway, that informed a lot of my decisions. And even going back to my surgeon who begged me to do chemotherapy when I was not wanting to do it because I didn't want to lose my hair, which has now been purple ever since. So I wouldn't have had that good fortune if I didn't do what she said. She even said, are you going to have regrets about not doing this if I have to see you in a few years for some, serious type of surgery? And I said, I don't know. I think that's making me nervous. I'm not feeling okay with skipping chemo at this point. And so the same applied to my decisions about alternative medicines. I knew immediately that I needed a naturopath because I believe in the healing powers of nature, and part of holistic medicine is the idea that your body can heal itself. And that does not necessarily apply to all alternative, integrative, complementary therapies, but in holistic medicine, the body can heal itself. And I knew that was true. And now, look at this, 10 years later, we are finding gene therapies targeted to specific cancers, which we see drug ads for on TV. Keytruda is one of them. And that has come out of the idea that your body's immune system is the strongest thing you have at your healing disposal. So let's engage your body's healing power. So I went to a naturopath. She had worked at one of those giant places called the Cancer Institutes of America, or the Cancer Treatment Center of America. There's one in Philly where she had worked, but now she lives up here. And so she already had a protocol of herbal supplements I needed, and she could answer questions that none of my doctors could, like, what should I eat? My doctors really were unable or unwilling to address the question of what to eat. And I knew that you are what you eat. I feel like that very strongly. Apparently my sister does too, because she has been helping animals with healing foods for a number of years. So I knew that what I had been eating perhaps was not the best thing, and I do credit some of my illness to, or my having cancer, I don't consider myself ill at that point because I didn't feel bad, to eating fermented soy. And soy has a very big effect on estrogen systems of the body. And let's say now they're saying, no, you should eat soy, but for a number of years they said, no, you shouldn't. I don't want to eat soy. I don't like it. I feel sick when I eat it. That is a signal to me it's a bad thing. So anyway, I can credit some of my having cancer to what I ate. So my naturopath was able to help me figure out what to eat. She put me on a lot of supplements, which I don't take all of now, but I still take probably 30 supplements a day. Many of them have anti-cancer effects, such as mushrooms. When I was going through the TED Talks, I came across one by Paul Stamets, who is an incredible mushroom guy, and he really, mushrooms can save us from practically everything. And his mother was diagnosed with cancer, and he gave her turkey tail mushrooms, and she had a pretty hopeless case. And whether the mushrooms worked or not, she's better now. She does not have any detectable cancer in her body. So one of the things I was taking were some mushroom complexes developed by Paul Stamets. And so I continue to take them because I do not want to get cancer again, and I want to keep my body in a state of optimal health. So working with a naturopath was really important for that. And then because of their background in traditional medicine somewhat, and certainly hers, I knew a lot of what I needed to do even before my other doctors signaled me to do it, such as scheduling bone scans and getting ready for the chemo to affect my bone density in an adverse way, put me on a bunch of supplements for that. And so I was able to really learn a lot about what I needed to do to get through having the cancer treatment in the best possible way. And she answered questions. For instance, nobody told me that you shouldn't eat grapefruit when you're on chemotherapy. None of my doctors mentioned this, none of the nurses. But my naturopath said, because I love grapefruit, I eat it all the time, and I love grapefruit smells and grapefruit oil, and she said, no grapefruit, because it has an effect of counteracting the chemotherapy. Like, how many people are told that? Not everyone. It's common knowledge, but people don't let you know. And maybe most people don't eat grapefruit, but I eat a lot of grapefruit, so that was a problem. She also, I was using, I think it was trommel. Yeah, it was trommel and rescue remedy throughout the cancer treatment for chemo and radiation. And I said, is this going to counteract the effect of that? Is it going to have a bad effect on it working on me? And in fact, she's probably the only person who could have answered that. No, it doesn't have a bad effect. So when I came home from a chemo treatment, I immediately started taking trommel, which is now called Tea Relief. And it's a homeopathic. So there's very small amounts of whatever is in there. So basically, it could be that I'm taking nothing to some medical professional's point of view, but it certainly helped me feel better. After I'd had maybe 2 trommels, I felt almost normal. And all it is a natural or homeopathic anti-inflammatory. So anyway, thanks to Bernie and his groups and working with my naturopath, I was able to find a balance that worked for me of alternative and conventional medicine. And the issue comes in when people who are diagnosed with something dire, some kind of stage 4 cancer or some hardly treatable cancer, resort to alternative medicines only. And sometimes there's an outcome of death in that case. And I won't even call it a poor outcome, because for some people it's not a poor outcome. But they pass away. Now, maybe they would have died anyway because they have stage 4 cancer. Or maybe chemo or something, surgery could have helped them. We'll never know. But that's partially why alternative therapies have been given a bad rap, because in fact people sometimes die when they're using them when they already have a life-threatening disease. And certainly from my point of view, Lyme disease, you cannot, in my opinion, combat Lyme disease without using conventional antibiotics. And it's a devastating disease. So of course you want to combine that with a lot of alternative stuff, because really Lyme disease can be really, really bad, and many of the other tick-borne diseases too. They can leave you just weak with joint damage and things like that. So it's really important for our dogs and our cats and our horses, when they have Lyme disease, I want to use, just like with cancer, everything I can to support them and help them get over it. And that may include several rounds of antibiotic treatment. And you know, probiotics are an important part of when you're using an antibiotic. And I don't know that my doctors ever have recommended that, but certainly my naturopaths have said, if you're taking an antibiotic, make sure you're on a probiotic. And here's the schedule you're going to use to take it, because it does affect the effect of your antibiotics. So I have to say that a combination of the two has been the best choice for me and for my animals over the years. So tomorrow, or the next day, I'm not here tomorrow, and I don't know about Tuesday, but certainly on Wednesday, we'll talk about how to make that choice for your pet, about whether to seek out holistic and alternative therapies. The general answer is yes, always, because everything can help them. But what might be going on with your pet that you want to seek an alternative therapy as well? That's more what we'll talk about. So thanks for joining us today for this episode of Conversations with a Corgi, where we've talked a little bit about alternative medicine and what that means. Someone might be getting a bath today. Biscuit. He has to be on TV with me on Friday. I think he needs to be fluffed and buffed. Thank you, Wendy. You're an inspiration to me too. Thanks for joining us today. We'll see you in a couple of days. Have a great day.